Face abnormalities, Anophthalmia. Ultrasound diagnosis. In microphthalmia, there is decrease in the size of the eyeball, and in anophthalmia, there is absence of the eyeball, optic nerve, and chiasma. Both can be unilateral or bilateral. Associated abnormalities. Chromosomal defects, mainly trisomy 13, are found in greater than 50% of cases. Genetic syndromes are found in greater than 50% of cases. The most common are Goldenhar syndrome, sporadic, anophthalmia, ear defects, facial cleft, facial macrosomia, Fraser syndrome, autosomal recessive, microphthalmia, facial cleft, tracheal atresia, bilateral renal agenesis, heart defects, syndactyly or polydactyly, Fryns syndrome, autosomal recessive, anophthalmia, facial cleft, micrognathia, ventriculomegaly, diaphragmatic hernia. Number 2, cataract. Ultrasound diagnosis, unilateral or bilateral opacity of the lens. Bilateral lesions are usually syndromic, whereas unilateral are usually related to fetal infection. Associated abnormalities. The incidence of chromosomal defects is not increased. Genetic syndromes are found in about 10% of cases. The most common include Walker-Warburg, autosomal recessive, type 2 lissencephaly, agenesis of corpus callosum, cerebellar malformations, cataract, and chondrodysplasia punctata, X-linked recessive, cataract, symmetric rhizomelic shortening, and epiphyseal calcifications. Congenital infection, especially rubella, toxoplasmosis, cytomegalovirus, found in 30% of cases. Dacryocystocele. Ultrasound diagnosis. Cyst, 75% unilateral and 25% bilateral between the lower part of the orbit and the nose. About 90% of Dacryocystocele are due to delayed canalization of the lacrimal duct beyond 32 weeks gestation. Differential diagnosis includes anterior encephaloceles. They are often associated with intracranial abnormalities such as hydrocephalus. Hemangiomas, they are usually solid or multiseptated, and dermoid cysts. These are usually located superolaterally. Associated abnormalities. The incidence of chromosomal abnormalities and genetic syndromes is not increased. Number 4, Epignathus. Ultrasound diagnosis. Solid tumor arising from the sphenoid bone. hard and soft palate, the pharynx, the tongue and jaw. The tumor grows into the oral or nasal cavity, or intracranially. Differential diagnosis includes neck teratomas, encephalocele, and other tumors of the facial structures. Polyhydramnios, due to pharyngeal compression, is usually present. Associated abnormalities. The incidence of chromosomal abnormalities and genetic syndromes is not increased. Number 5. Facial cleft. Ultrasound diagnosis. The typical cleft lip appears as a linear defect extending from one side of the lip into the nostril. Cleft palate associated with cleft lip may extend through the alveolar ridge and hard palate, reaching the floor of the nasal cavity or even the floor of the orbit. Both transverse and coronal planes are necessary for the diagnosis. Color Doppler may be useful to demonstrate flow across the palate in the case of cleft palate. Diagnosis of isolated cleft palate is difficult. Diagnosis of cleft lip and palate at 11 to 13 weeks gestation can be achieved by targeted examination of the retronasal triangle in a coronal view and the maxillary gap in the standard mid-sagittal view of the face used routinely in screening for chromosomal abnormalities. Number 6. Hypertelorism. Ultrasound diagnosis. Increased interorbital diameter greater than the 95th percentile. Number 7. Hypotelorism. Ultrasound diagnosis. Decreased interorbital diameter less than 5th percentile. Hypotelorism is part of the midline migration defects together with holophrosecephaly, which is almost always present. The degree of hypotelorism can be extreme as in cyclopia. Number 8. Micrognathia. Ultrasound diagnosis. Subjective finding of prominent upper lip and receding chin in the mid-sagittal view of the face. These findings may be due to micrognathia, short mandible, or retrognathia, backward displacement of the mandible. Severe micrognathia is associated with polyhydramnios, greater than 25 weeks gestation, due to glossoptosis, normal tongue obstructing small oral cavity. Number 9. Nose anomalies. Ultrasound diagnosis. There is a spectrum of midline abnormalities of the nose in association with holoprosencephaly, including arrhynia, complete absence of the nasal structures, proboscis, soft tissue appendage projecting from just below the forehead, and single nostril, usually central.